Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Dr. Andrew Quint and Beth Rahn, a nurse who has worked with him for 11 years at Family Health Center in Columbia. They spoke about the patients they have seen over the years and how those patients have changed their lives. Here's Dr. Andrew Quint.
We have a lot of people here with depression and anxiety and some other behavioral health problems, and a lot of people who have chronic pain, a lot of people who have done hard labor over the years and kind of worn out their bodies and now have a lot of pain issues. And that was probably the thing that surprised me the most coming here. I thought it would be trying to help people with things like high blood pressure and diabetes who didn't have health insurance and needed help with medications and testing. And there is a lot of that, but I didn't expect all the chronic pain, and I didn't necessarily understand how much mental illness it would be. What do you think you would change about the lives of our patients if we could?
Well, if I could change them, I wish that everyone could have insurance. Everyone could be able to get their meds, not have those worries, that they had transportation. And I'm sure that I wish that they all could get to the grocery store, get to stores. Their lives are so different than my life. I wish I could give them my life so they could have everything they ever wanted in life.
Is there a time you can think of when you really, like one particular case where you think you really changed someone's life for the better?
Yeah, I can remember Christmas Eve a couple years ago, a patient who had wounds on his leg and the dressings needed changed. And he couldn't get here, and so I had talked to him on the phone, and he had told me that he hadn't eaten for a few days because he couldn't leave his apartment. I went and picked him up some food, and then he needed antibiotics, so we called those in. I went and picked those up for him, got him bandages that he could handle putting on. I stayed there a while and did a few house chores for him, and once again, he will probably be in my memory forever.
People are fond of saying that we have the greatest healthcare system in the world, and we do have some great things about our healthcare system. We have great doctors and nurses. We have incredible technology, but I believe we have a very bad healthcare system that leaves a lot of people behind, and it causes unnecessary suffering. And I certainly would, if I had the power, I would certainly change our healthcare system. But I think one of the things that Beth and I are kind of similar about is you have the system that you have, so you don't beat your head against the wall about the system. You figure out a way around the problem. You solve the problem at hand with that one person who's in front of you at that moment, and you try to fix what you can, and then you move on to the next one. Yeah, I think we're a good team.
I think so.
That was Dr. Andrew Quint and Beth Rahn speaking about their patients and how their many years working together at Family Health Center in Columbia have changed them. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.